Hello and welcome to the Unit 3 lecture on documentation for nursing fundamentals. These are some of your learning objectives for this unit. The remainder are listed on the communication presentation and the complete list is in E360. So why do we keep a patient medical record? We do so to prove that cares and treatments were performed and to provide a source of communication for the medical team. Some other reasons are listed here. Electronic medical records provide a way for patients' records to cross specialties and sometimes even organizations. The intent was first mandated with HIPAA privacy laws and outlined a need for comprehensive database that the patient can take with them. In reality, though, data can only be transmitted across organizations if they use the same EMR software. EMRs allow for safer patient care through the use of barcode technology, computerized physician order entry, and drug interaction flags, among other things. These are the do's and don'ts of proper documentation. Maintain confidentiality. Only discuss patient information with those professionals directly involved in patient care. Do not discuss with family or friends without the permission from the patient. Do not discuss patients with or without names in public places. Never leave a computer with patient info unattended. Do not remove the chart from the patient care area unless you're accompanying a patient to a procedure. Students should write information for assignments without patient names. Accuracy. Only chart observations you have seen, heard, felt, or smelled. Use precise measurements and times when possible. Use correct spelling in medical terms. If there's an error, you must draw one line through and write charted in error with your initials. Documentation should be complete and includes assessments, nursing interventions, medications given, provider's orders carried out, provider notification of a change in patient status, patient teaching, patient responses, and any change in the plan of care. Should be concise. Use partial sentences, drop patient's name, and only use approved abbreviations. It should be objective. Directly quote statements made by the patient in quotations. For example, you would put in quotations, the patient states he is missing the company of friends and is upset they are no longer visiting, end quotation, is more objective than, end quote, patient is lonely and frustrated, quotation. Describe actual behaviors, don't interpret. Organize chronologically. Should be timely. Point of care documentation is best. So, for example, you could use care mobiles to enter vital signs and medications, and you should document medications immediately at the time given. Document procedures, treatments, and assessments as soon as possible, and make sure to timestamp the documentation that will coincide with the time you actually perform the action and not the time you're documenting the action. Use 24-hour military time and avoid batch charting at the end of the shift because this could cause omission of important data or inaccurate information. If it's a paper system, you want to write legibly. Charting by exception is documentation using flow sheets to make charting more efficient. Normal findings are checked off while abnormal findings are expanded on. The three types of nursing notes are listed here. Narrative notes tell a story. SOAP notes are more focused on one issue. The S is subjective. This is the data or the symptoms that the patient expresses. O is objective. This is the data collected by the nurse applicable to the problem, such as what the RN can see, hear, smell, feel, lab data, diagnostic tests, and vital signs. A is assessment. This is your diagnosis, impression, or condition change and is made after analyzing the subjective and objective data. P stands for plan, and this is the nursing intervention specifically related to the identified problem. It could be as simple as continue to monitor. A concise DAR note should be written for each abnormal problem noted on the flow sheet. D is data. This includes the subjective and objective information for that problem. A is action. This is what was done. And R is response by the patient. Did the problem improve or not? And what further follow-up is needed? This slide may be a little bit difficult to read, but it's just a charting by exception flow sheet example for paper charting. This is an example of a DAR note you can read through. In one of the sections in E360, there's a copy of the various forms used at a skilled nursing facility. This information is presented in preparation for your clinical rotations at nursing homes. Not only do you routinely document, you go through and audit the documentation. This is done for reimbursement and quality assurance purposes. So what if you make a mistake or a patient falls or there's some other incident? Incident reports are separate reports used to document occurrences. The report is not meant to be punitive, it's meant for learning and improvement. The specifics of the incident, such as the patient attempted to get up alone and fell, landing on his left hip, along with interventions and outcomes of the incident, are documented in the patient record. The incident report, though, is not mentioned in the patient chart for legal reasons. This is an organizational tool and not a part of the medical record. If you mention that there was an incident report filed in the documentation and there was ever a lawsuit or something brought against the organization, then mentioning of that incident report opens it up to the legal system, and then they are allowed to have access to that report. So that's the reason it's not mentioned. So pause here and think for just a few minutes. How would you chart if you administered the wrong medication to a patient? So to recap, just be sure that you can answer the bullets on this slide, and these are all things we covered, such as data and charting, the objective and subjective, how to document a patient's exact statement, documenting an error, and then discussing how to complete an incident report. And that concludes this presentation on documentation. Thanks and have a great day.